Y regresamos aquí de nuevo a Vive Sanamente. Estoy compartiendo con mi profesor, amigo, mentor, segundo mentor, porque mi primer mentor es mi querido padre, el doctor Norman González Chacón, el doctor David Pesek es el que me introduce al concepto de la iridología holística, al punto de que me motivé tanto al tomar el primer curso que decidí tomar todos los cursos y terminar mi grado diplomado en iridología holística, algo que ha cambiado drásticamente mi práctica en términos de la forma en cómo evalúo o evaluamos al paciente en nuestra clínica. Dr. Pesek, there is something that is really important in terms of the difference between assessment, evaluation, assessment, and diagnóstico and diagnosis. I want you to explain us, I think we have the first slide talking about that, but I want you to explain.
You know, with holistic iridology, what we're doing is we're not diagnosing by looking at someone's eyes and labeling someone with a particular disease like a medical doctor would do for insurance purposes. What we're doing is looking at the whole body. We're looking at as we mentioned earlier, the thoughts, the feelings, the physical body. And in the eyes, we can actually see predispositions that someone might have that they have no symptoms of. And it might be 20 or 30 or 40 years before they even develop anything that is related to what we see in the eye. So it's a wonderful tool of prevention. So holistic iridology is not used for diagnostic.
Dice ahí que no se utiliza para el diagnóstico de enfermedad, sino que se utiliza como un sistema eficaz de evaluación para las condiciones y niveles de salud. So when we evaluate the iris of a patient, we're looking to genetic constitution or predispositions.
Sí.
We're
also looking at color. We want to see the color of the iris. We're looking at the fiber structure of the iris. We're looking at accumulations and conditions that have developed in the external ocular structure. Because in iridology, from a holistic point of view, we evaluate the sclera, the conjunctiva, the cornea, the pupil, and the iris.
Correct.
All of those things together, as you know, as one of my graduates, as a diplomado in iridología holística, that you know that. You've been very well educated with that. And I also am proud to say that you are the valedictorian of the class that you went through a couple years ago, that you earned, as you know, but I want to tell our audience that Dr. Norman was my star student for the entire year that he went through the program. He got the highest grades of anyone around the world to achieve that distinction of valedictorian of the class of 2011.
I've had good teachers, including the iridología holística that you taught me, and with my experience, all that put together got me to that point that you just mentioned, and I'm really honored to hear that from you, Dr. Pesek.
I'm very proud of you, what you've done.
I'm humble and honored about that you just mentioned. Thank you very much.
You're welcome.
We were showing, before showing the pictures of the eyes, I want you to tell us about iridology in the context of the world. You know, what's going on with holistic iridology around the world.
Sure, and you know, iridology itself, the conventional practice when it was physical only in reading the eyes for conditions of health, goes back 3,000 years. 3,000 years, 1000 BC. It's amazing. But today, what we're looking at is that iridology has reached all countries and is practiced at different levels. In some of the South American countries that might not have the economic aspects that's strong, they still use a luz and a lentes, and they read the eyes like this to examine, and their level of knowledge is not very advanced. But we can go to a country like Germany, and in Alemán, they have practiced iridology for 130 years, 140 years.
Okay.
And we know that the German personality and the culture, they're very precise people. And if iridology wasn't valuable, the Germans wouldn't be doing it. It's a credit to what they've done, but they've advanced it to where you actually have to go to school to become an iridologist. There's a training for that. In Russia, right now, the medical doctors, the medicals are the ones that use iridology.
Right.
Even in hospitals, they practice iridology.
That is really a recognition of a valuable tool.
A very valuable tool. And so what we're seeing now is that holistic iridology is now starting to move into these places where conventional physical iridology is being practiced, and people are now embracing this opportunity to see the whole person, not just the physical.
Something very important is that when I studied the history of iridology, it's very interesting that most of the people that practice iridology and started searching about iridology in the modern era, I mean, last century and this century and late 19th century, were medical doctors.
Yes.
And there is a doctor in United States that brought iridology, Dr. Lindlar, right?
Henry Lindlar, medical doctor around
I think
Chicago.
we have a slide about
do
Dr. Lindlar.
Do we have a slide up here?
Yes.
It's a picture of me at the podium at our Congress, and the statement that Dr. Lindlar has, I'll read it, and then you can do it in Spanish for our listeners. The regular school of medicine as a body has ignored and will ignore this science of iridology because it discloses the fallacy of their favorite theories and practices, and because it reveals unmistakably the direful results of chronic drug poisoning and ill-advised operations. Henry Lindlar, medical doctor, nearly 100 years ago, he spoke out about this. And in the United States, when the medical doctors were speaking out against the beginnings of the drug companies didn't like that, and they put pressure on the medical schools, the naturopathic schools, the chiropractic schools, the osteopathic schools, to eliminate the teaching of iridology.
Yeah, because iridology was revealing, as it says in the thought of Dr. Lindlar, that the methods they were using, the drugs they were using, were doing more harm than good to the body. And they couldn't have something that were exposing them to something that it was in detrimental of the health of the people.
Exactly.
So they had to take iridology out because, iridology is not telling us that, it's telling us or revealing that what we're doing is not good for the patient. O sea que lo que el doctor Lindlar trae, y vamos a ver de nuevo el pensamiento para traducírselos al español, es que la medicina, ¿verdad?, institucional ha tenido que quitar la iridología del sistema médico porque revela sin fallar que el efecto del uso crónico de drogas estaba envenenando y las operaciones que se estaban haciendo estaban afectando al individuo. O sea que la iridología revela claramente, cuando algo se está haciendo bien y cuando algo se está haciendo mal. Y entonces there is a concept brought by Dr. Nathaniel Brandon. I don't know if you've heard about him, but he says that when there is contradiction, there is destruction. So you have to straighten your thought. See, and what medical science did was take out iridology in order not to have this contradiction of the iris telling that what we're doing is wrong, instead of fixing what they were doing.
Right. You know, the good news is there's always a good news side to this. And I believe, and I see it around the world, because you were asking me about the state of iridology around the world, holistic iridology, is that medical doctors are now beginning to awaken with their free thinking. They are breaking away from their teaching from medical college and the pressure from their peers. And medical doctors are now waking up to the practice and the value of holistic iridology.
And that is good.
It's
that
excellent. That's
excellent
the good news.
That is excellent news because they are validating the scientific iridology as scientific, and also they are starting knowing this whole concept of holistic iridology. They are including and they are validating also that iridology could be a good tool also for the assessment of other areas of the body, as is in the general interest. We are every day we are getting more exposed to the situation or to the comprehension that the body is a whole, mind, body, spirit, organs, systems, cells, energy, everything is integrated, and science can no longer put that reality on the side. It has to go with it because it's in the interest of the majority of the people. I have patients, doctor, that when they come, they go to the office of their primary healthcare physician. They tell them about the experience they are having in the complementary medicine, in the natural medicine,
in the integrative medicine.
Exactly. And when they go with this positive experience, the doctor has to say, if it's going good, okay, keep doing it.
Yes, sure.
Okay, and that is going up every day. We see more of that kind of attitude in the medical field, especially with the young doctors that are graduating recently, because they've been exposed to the literature. We have scientific papers every day validating integrative medicine, natural methods, and in that sense, we have the advantage of people that can tell about their experience.
And there's a brighter day. Every day we're getting better and better and better.
And it's going to be getting better. Tenemos que hacer una breve pausa, pero regresamos con más de iridología holística con el doctor David Pesek.